You gotta join on your phone, you know. Yeah, I got a notification on mine. Yeah.
Are we live?
We're live. We're just waiting for the party to begin.
Perfect. 7:30. I'll text my friend group that I golf with. Tell them we're live now.
Yeah, it's official.
I can't hear you. Hold on.
Oh, we gotta go now?
Text group, we're live. We are live. Oh, didn't see you there. My name's Chuck Bachi with 3-Dimensional Physical Therapy, and I am here with the one and only Doctor of Golf, Paul Harris. Paul's here today to answer some questions about golf and TPI. Paul, would you like to add anything to that before we start the questions?
No, just quick introduction. Been a physical therapist for just over a year and a half now. Been TPI certified through Titleist for that same amount of time. So we've been pushing this pretty hard. So I'm excited to see what kind of questions we got coming in.
And I'm Chuck Bachi, also with 3D PT. I've been practicing for 15 years. I'm also TPI certified, and I guess we'll get going with the first question. So the first question that came in is, what is TPI certification, and how does it help golfers improve their game? Paul, would you like to take this one?
Yeah, so Titleist essentially came up with a way for people to assess or screen people. Especially as physical therapists, we have done this, since the beginning of time pretty much, but now we can do it for golf-specific people. So through Titleist, there's multiple different types of certifications you can get. So we're both level 1, which gives us the opportunity to screen you guys through their app. And pretty much what this does is we look at golfers and we don't try to pick a perfect swing. When you come in to get an assessment with us, we're not going to say, all right, how do you look compared to Rory McIlroy? How do you look compared to Bryson DeChambeau? It's pretty much going to be, what's the swing for you? And by doing these 15 different screens through Titleist, we can essentially get a good picture on what things you can and cannot do with your body, whether that be shoulder mobility, back mobility, hip mobility, certain strength components. A lot of that's going to be looked at. So that's pretty much what the TPI screen does. And soon I'll be, level 2 certified through power and fitness, which gives me the opportunity to not only look at the level 1 screen, but look at how are you producing power. Is it good in upper body, good in lower body, or is it vice versa? Maybe one struggling a little bit more than others. So it'll be fun to see, how that kind of component works as well. So yeah, it's been good.
All right, cool. So the next question, how can physical therapy improve swing mechanics and overall performance? So Paul, I think you kind of already touched on this, but maybe you could elaborate specifically on how improving swing or how physical therapy itself can improve swing performance.
Yeah, so when we look at a screen through Titleist, the big components that I feel like I always look at are shoulder and hip mobility. That's a big one that I'm like, okay, can we move through those joints? Your glute and core strength. Do you have the ability to produce force at certain moments, so like up here versus through the golf swing? Your balance, and then how much extension can we get at our spine? Those are like our big ones that I feel like I look at. So through physical therapy, we can address all of those. There's not one in there that we don't address when you come in. So if you're someone that is great with hip mobility, but maybe you lack shoulder mobility, you might not be able to rotate a certain way. So we can help improve that, which in turn is going to help improve your golf performance.
So it sounds like a lot of what TPI does is look for limitations in mobility or strength, and then you can kind of focus on those to improve. And by improving mobility or improving strength, it'll result in either better swing mechanics or just better performance on the golf course?
Yeah. The great thing is we're experts in anatomy and fitness. So when we think of a way of increasing motion or strength, that's where the ball game really fits for us. And now taking through Titleist, we can say, how does that apply to your golf game? Because you might move your hips a certain way that you didn't think of before, but now we can address that from our standpoint. That's going to translate right to your game.
All right, cool. Very good. Next question. What are some reasons I'm having shoulder pain after a round, and how can I fix this? So is this a common question you get asked, like about shoulder pain?
Yeah, I would feel like no matter what age golfer comes in, they're always going to say, oh, I have pain somewhere. It's just a part of life as a golfer. It's really hard to go throughout your entire, career, if you want to call it, and not have pain. We all deal with it. And And the best answer is it kind of depends. You know, if I have 10 people coming here right now and they're all golfers and they all have shoulder pain, I'm going to treat every single one of those 10 people different. Because it might be, oh, you had your shoulder replaced. Well, that's a big difference than, oh, I'm having shoulder pain and maybe it's coming from your neck that we didn't even get to look at unless you come in. So a lot of stuff that we look at isn't necessarily looking at just your shoulder. If you have shoulder pain, great. That gives me some insight on what to look at. But I'm going to be looking at your whole body to see are you limited somewhere else that's causing that shoulder to maybe have to overwork or do something it's not supposed to be doing. So
it sounds like you're saying, hey, you can't just go based on I have pain in this area or that area. You're going to look at the whole person, a holistic approach. You're looking from head to toe, and you're going to, based on a screening, you're going to determine, hey, you know, I know you're reporting shoulder pain here, but is it possible that there could be limited like rotation of the spine that's putting pressure on the shoulder? Is that like one thing you might look for?
Yeah. So I mean, this is a shoulder example, but I'll give one that they kind of taught me when I was in Florida with the TPI screen in person. John Rahm, great golfer. He was #1 in the world for many years. He actually has a fused ankle. So he can't use that ankle to move like a normal person would usually do. So how does he get his power? Well, he has an insane amount of rotation at his trunk and shoulder. That's great for John because he's able to produce the force, but that also puts his upper body in a position where maybe it's a little bit too much. So they're constantly, and when I mean constant, like they're doing TPI screens on John Rahm every single day because they want to know, hey, is your golf game maybe struggling because you're not having the mobility that you once had? And vice versa. Maybe you're having a little too much. Maybe you're having more than we expect. So when we look at any joint, you know, if you're limited in or if you're limited in shoulder mobility, you have to compensate somewhere else, whether that be your elbow, whether it be your wrist, whether it be your trunk. And that's where sometimes we lead to those overuse injuries because you're now using something that maybe isn't supposed to go as far as it is, and you're doing it a little bit too much.
Yeah, that makes me think of the TPI that we're both certified in. It's part of the family of screens that includes the functional movement screen and selective functional movement assessment. Functional movement screen is something that they at the NFL Combine, they take all the guys through that, and it looks at the way their body moves. The TPI one is just specific to golf, but a big thing that they preach there that I've really adopted into my clinical practice is this concept of regional interdependence, where you know, I like to joke with my patients. I'm like, well, you know, the knee bone's connected to the hip bone. But the concept there is like, hey, if I have a shoulder problem, it's not necessarily from my shoulder. It could be, you know, as Paul's alluding to, other parts of the body where maybe your shoulder pain is actually because your left hip is tight, and then your follow through, if you're righty, it's you're overcompensating and extending your shoulder, something like that. So it could be from different parts of the body. The best example I use when I have clinical students in that I'm teaching on a rotation is a study that they did actually for baseball, where they looked at elbow and shoulder surgery and arch height. So what they found was the athletes that had either high arches or flat feet just had more elbow and shoulder surgery. And that's the best example I've ever seen in the literature showing, hey, there's it wasn't necessarily a correlation, but it was a just like there was some sort of relation there. There's more surgeries with people that had high arches or flat arches, and it really demonstrates that concept of regional interdependence, where one part of the body is affecting the other. So if you have a high arch or flat arch, you might change the mechanics going up the chain and put more pressure on your elbow or shoulder in a throwing motion. So you can imagine how that might apply to golf, where, you know, I think the common patterns we see probably low back pain is one of the top ones, and shoulder pain. So we can kind of see, you work with a lot of golfers and you kind of see these patterns of, okay, you know, like Paul was alluding to, hey, a lot of times with the back pain, there's some glute muscles that are a little bit weaker, maybe some core muscles are weaker, and you might not have as much mobility. I think Paul said the thoracic spine, which is like the upper back, the part that your ribs are connected to. So if you're having low back pain, sometimes if your upper back is stiff, you're going to torque your low back a little bit more. That can cause like some pain. So I think we've kind of like answered that question sufficiently.
Yeah.
So I think we'll go on to the next one. Hopefully we're not being too long-winded. Producers in the back will tell me.
Yeah.
We're good on time? All right, so how does mobility in the hips and shoulder affect the golfer's swing? We're kind of like already talking about this. You want to jump into that?
Yeah, pretty much. If you have limitations in hip mobility, that's going to lead to you probably doing something in the swing that's going to lead to maybe an injury down the road. I think one of the questions we got asked was, like what's one of the most common injuries, and you kind of alluded to low back pain. Well, we're probably having that low back pain because we're not able to rotate correctly. And that forces us to try to, and we all get to the point in our golf game where we want to hit the ball far. So it's very hard to tell somebody, hey, just calm down when you swing, because they're going to try to hit the ball as far as they can. And when you do that, you end up putting yourself in situations that sometimes your body's not supposed to be in. It's called like a reverse spine angle is like the main injury I feel like I usually see when amateurs are swinging. It's because when we rotate, instead of just rotating around our hip, we actually side bend towards the ball. I'll demonstrate maybe later on at the end when we get up. But by doing that, we almost have to, instead of just rotating back down, we have to go from one side all the way back to the other, which puts a lot of stress on the low back. So again, a lot of the injuries aren't just from where the pain's at. It's coming from somewhere else.
Now, if you're noticing that with one of your patients, are you like trying to correct the swing? Are you referring to the golf coach? Do you communicate with the golf coach?
Yeah, so that's the really cool thing about TPI is, we're the medical professionals, but there's also the fitness. So you have like your personal trainers. You also have the swing coaches as well. So when someone comes in, I have the ability to look at a swing and say, okay, these are the things that's going on from a swing standpoint, but I'm not going to correct that. That's going to be from the golf coach standpoint. And they're going to run through the same exact screen that we ran through and get the same exact results. They're even going to get the screen that we got, and it's going to be sent to them so they know, hey, Paul's a PT. He just evaluated them for their low back pain. I'm working on them with their swing. This is the score they got with Paul. These are the things that they're probably not able to do in the swing based physically from their physical assessment. So I'm not going to correct the swing. I'm going to correct the physical components of it so then when the swing occurs from the coach, they can get into that position. Because if a coach tells you to get your arm all the way back here and you can't physically do it because you're stuck here, it doesn't matter how many times he tells you to get up there, you're never going to be able to get up there.
So if there's a physical mobility limitation, it's not going to, your swing's not going to be, you're not going to look like, Rory or something like that.
And that's why there's no perfect swing.
But we know that, like you mentioned John Rahm before, somebody with a physical limitation is able to compensate with more mobility than your average person with his thoracic rotation.
Yeah, and that's the same with baseball players. I mean, look at how much rotation they get in their shoulder going into external rotation or backwards, but they're going to lose a lot going forwards because their body compensates. So it's the same thing with golfers.
It's interesting because I remember being a kid playing the game, you'd get into a baseball swing stance swing, and your buddies would have to guess like who you're mimicking because everyone had such a unique swing. You could guess, oh, that's this guy, that's that guy.
Yeah.
I think it's like really like the same for golf.
Same for golf, yeah.
All right, we've got another question in here. Can you demonstrate one simple exercise or stretch that all golfers should be doing?
All right, do you want to do that now? Or? All right,
I saw it was highlighted.
It's a little highlighted over here.
You're throwing me off. All right. Excuse me for a moment. Now for the next question. What's one mistake amateur golfers make that leads to pain or injury?
Yeah, that was kind of the one that I was talking to about like we call it the reverse spine angle. I feel like everyone should Google that too because you get a good sense on, there's so many videos out there that talk about this because it's one of the most common things that people tend to do because they want to get more power. You learn, okay, to create more power, I have to swing a lot harder. I got to really increase the width of my swing. But if I can't get there because my hip's limited in internal rotation or external rotation, then I'm going to have to get it from somewhere else. So we end up side bending different directions, which all of a sudden throws everything out of whack.
So a common thing you see is because there's a limitation of mobility is it the back hip?
Yeah, so if you're thinking of a backswing, that's where we tend to think of like the torque. So I want my upper body, and we didn't really touch on this too much, but we have to have the ability to move our upper body on our lower body and vice versa. If you look at the best golfers in the world, this is what they're the best at. They can do it without having any issues. Like it's the back of their hand. They know it like that. So when we look at someone that maybe isn't a pro, that is trying to start with golf or they're having issues with consistent swings, they're probably moving both parts. So they're probably moving their hips and their upper body at the same time to generate that power because they're thinking, okay, I need to get my swing a lot further back, and they're just doing what their body's going to do. So a lot of times we're lacking the mobility at the hip, or we're lacking the stability at the core to even allow the upper body to move without the hip moving too. So there's multiple things we have to look at, and that's why the screen's great because nobody swings the same. we're going to be able to work on different things with different people. But yeah, a lot of it I feel like comes from a lack of mobility or a lack of stability, somewhere around the hip or core area.
Generally hip or core.
Yep.
Like generally, would you say it's generally mobility at the hip and strength at the core?
Yeah.
If you had to say 100 golfers you worked with,
Yeah.
you're going to find that with
A majority of them, I would say, have a really hard time moving around their hip.
And what we in physical therapy we call that like dissociation of the hips and shoulders. Is that correct?
Yeah.
So like moving them in different. Whereas you might see somebody that is moving like one unit. You want to see them move independent of one another.
Yeah.
To create like a whip-like action.
Yeah.
Right?
Exactly.
Yeah. Very cool. All right. So our next question is, let me see here. What's the role of core strength in generating power in the golf swing? Well, so we just talked about two of the things. It's hip limitation of mobility and core strength. So how does the core strength like actually generate the power that like how does like if I'm doing planks, right? How does that help me with my golf swing?
Yeah, and that's why it's important to go to someone that knows what they're doing, an expert in this kind of field. Because if I tell someone, hey, go make your core stronger, they might prescribe planks, they might do maybe sit-ups, and great, you might get your core stronger in that sense, but it's not golf specific.
Right, it's because it's like that's like a plank. I'm just sitting there not moving, or if I'm doing a bunch of crunches. I think a lot of people think of core strength like that, like, oh, I feel like I'm getting 6-minute abs or something.
Yeah.
So what kind of core strengthening would I want to do to improve my golf game and also prevent injury?
Yeah, so you want to do, I feel like I tend to do a lot of things in single leg stability, because if you think of the golf swing, a majority of my weight when I do my backswing is going to be on my right leg if I'm a righty, and then I'm transitioning and most of my weight's going on my left side. So although we don't think about it, golf really is almost a single leg sport. You're not getting much stability from the other side. So a lot of times I'm trying to work on getting them to move their upper body while maintaining stability on one leg, and that's going to work that core. You'd find it surprising at how hard it is to do a lot of these exercises on one leg, and a lot of it's coming from the stability at the hips and the core.
So you find that because there's such weight shift throughout the swing, when you're working as a physical therapist or working with golfers, you're doing a lot of unilateral standing on one leg, doing different core strengthening because it's specific to golf, and it prepares your core for that transition of weight shift for the front to the back.
Yeah. You always have to ask, like, what is the reason you're doing the exercise? Is it because you want to hit the ball further, or is it because you want to get more consistent? I'm going to do two totally different things. If it's power, I'm going to load up a light weight and let's swing it as hard as we can in a golf-specific fashion. But if it's, I want to work on getting our upper body to move on my lower body to be more consistent, then that's a whole different ball game. I'm going to go a lot slower, maybe load it up a little bit more to make sure we're working on a lot more stuff, stability aspect. So it all comes down to why we're doing it.
So not only, like you said earlier, hey, like with the person with shoulder pain, hey, you got to evaluate them. You might have 10 people with shoulder pain, but the treatment's going to be different for all 10 based on their body.
Yeah.
You're also saying, in addition to it being different based on their body and your exam, based on their goals, the treatment's going to be different.
Exactly, yeah.
So it's like very specialized to the individual based on their body, their mobility, stability, strength, and what their goal is, whether it's consistency versus just raw power.
Yeah.
And then will it change? Like, let's say you're working with somebody and, man, they just added, 30 yards to their drive. And they're like, yeah, but now I'm kind of like, I'm in the rough left and right, like I'm not consistent. Well, then, will that change, like, your approach with, therapeutic exercise and stuff like that?
I think it would more change from the golf coach's standpoint.
So you, at that point, you're like, hey,
yeah,
this is, and do you communicate with the golf coaches, or?
A lot of the times, if the coach is TPI certified, and we can see that through the app, they're getting everything that we're sending. They
so
know
you don't even need to, like,
we wouldn't have to necessarily like call or say that, but through TPI, you can get messages from coaches. If a coach in the area is like, hey, I'm dealing with a golfer and they're having low back pain, can you treat them? Like, great, now we both know their TPI. I'm going to assess them. They're going to assess them using the same criteria, and we're all working on the same stuff. They know I'm not sitting here and doing a golf lesson when I'm in there, and I know when they're out there, they're not going to try to prescribe an exercise they don't know how to prescribe. So really staying in our expertise is a big thing.
Yeah, good. Let's see, next question. How can older golfers maintain flexibility and avoid stiffness over time? I feel like, is this at me?
Yeah, this might be a you one. Yeah, this might be a you one.
Well, since I'm older than Paul, let me take this one. He's been answering all the questions. So how can older golfers maintain flexibility and avoid stiffness over time? Well, one, I think it starts with like you have to have like a goal without a plan is a wish. So you have to have like a plan to do it. So if you have identified, hey, I'm really stiff, my swing is not what it used to be. I can't even drive 200 yards. With the older golfers, it's usually a mobility issue. Generally, as we age, especially men, tend to lose some mobility. So you have to like identify the problem. Is it mobility? And flexibility. And if that's the case, you need to like design your exercise routine around that. So that might mean you shift from doing, some weightlifting, or you shift from sitting on the couch to doing some yoga or Pilates, to doing like a regimen. And also like, driving an hour to a golf range, touching your toes one time and lifting the club above your head may not be sufficient to warm yourself up, for 18 holes of golf. So you probably want to, like have a plan in place for if you really want to avoid that stuff, you have to just work at it, just like anything else. So you just need a program that you're maintaining flexibility in your hip flexors, your hamstrings, and your upper back and lower back and hips. So it's just like a lot of mobility work. That's probably the best thing you can do to avoid stiffness and maintain flexibility. So the next question, if a golfer is dealing with low back pain, what's the first thing they should address? Would you like to take this one, Paul, or should I?
You can take it.
All right, I'll
take it.
One. I like this. So, it's tough with these questions. The answer is often it depends. So it would depend on like why you're dealing with low back pain. Generally, you want to avoid the offending activity. So if you're able to identify what activity is causing pain, you want to avoid. Now, that's probably not what you want to hear if you're a golfer and golfing is what provokes pain. But you definitely want to follow what's called the soreness rule, which is if you begin an activity like golf and you have low back pain or soreness, and as you continue to play, it gets better, you should be fine to continue a round. On the other hand, if you begin a round of golf and you don't have pain, but after hole 9 or 10, you start to get pain, you should really just stop the round because it's likely just going to keep getting worse throughout the round and you're just not going to enjoy yourself. It's much better to go seek medical care and address the issue right off the bat. I have seen a lot of times, people come in that have been dealing with chronic pain, meaning pain that has been going on for more than 3 months, and it takes them much longer to get better when they delay seeking treatment. The best thing is to act quickly. It's, early detection, like figuring out why do I have this pain, and working with a physical therapist to address the why and the issues. And as Paul and I have been talking about, it's often a mobility issue at the hips or strength issue at the core or some combination of that. And it's our job to figure out, is there a stability motor control dysfunction, which would just be like basically some strengthening and like how you're moving your body. Is it you moving it the right way? Is it joint extensibility, which is just like your flexibility, or is it joint restriction, like the actual joint? As you get older too, like you get some arthritis in the joints, they're just not going to move like they did when you're 20. And if there's limitations there, you'll have to learn ways to adapt or compensate. But what often happens is like the hips get tight, and then you put more pressure on the back, and then you're dealing with back pain. So sometimes it's as easy as just loosening up the hips with different, exercises. I mean, like the one I'm doing right now, stretching my hip like this can be very helpful. Let's see. So I think I sufficiently answered that question. We'll go on to the next one.
I think one thing to touch on with that is, and I feel like we don't hammer enough, is direct access. I feel like you can talk about it a little bit more. Is if you're a golfer and let's say I'm playing today, 4 p.m., I hurt myself at 5 p.m., you can call, depending on what insurance you have, and I'll let you touch a little bit more on that, and you can get seen for, with a PT that day. So don't feel like it's something that you have to go see a doctor and find this MRI and this X-ray, and then all of a sudden it's a 4-month-long process. But we can see you right away a lot of times and diagnose what's going on.
Certainly in New Jersey we can do that with every insurance except for Medicare. Probably a good thing to do, because in case we're getting people from different states, is you can go on the TPI website. It has everybody listed, right?
Yeah.
So at least if you go to TPI's website, you can find a provider that's TPI certified. That means they probably really like golf, and they're gonna be able to take you through the screen and address some of this stuff. But yeah, so in New Jersey, direct access, call 3DPT anytime, or go on our website, request an appointment.
Yeah, there we go.
With the golf doctor himself.
Yeah. Schedule's open. Not much, but it's open.
He's going to open more hours.
I'm open more hours,
Open
yeah.
hours for you.
Saturdays just for golfers.
Saturdays,
That's it.
Sundays, you may have to barter and take him out for a round.
Yeah, that's it.
That's it. All right, so what should I do if I experience pain in my elbow? So this is a common one, right? There's even a name for it. Golfer's elbow. So golfer's elbow, be the medial side. A lot of times it's, if you're hitting the dirt a lot, why can't I?
You're chunking?
If I'm chunking.
Yeah, getting a little chunky.
I just never do it, so I can't remember the word. But if I was to chunk, you get like irritation of the common flexor tendon over here, like right by the elbow. Tennis elbow is like on the other side, it's on the outside. You don't need to play golf or tennis to get golfer's elbow or tennis elbow. But generally, there's a couple braces they sell that you can put on there. You're going to want to do some gentle stretching here. And then for any tendinopathy, that means like a disease of the tendon, whether it's the golfer's elbow, tennis elbow, which would be medial epicondylitis, lateral epicondylitis, patella tendonitis, Achilles tendonitis. Those are probably 4 of the most common ones we see. When they're disease of the tendon, in the acute phase, when it first happens, traditionally treatment would be rest, ice, compress, stretch the muscles out, and then to help strengthen them, you do what's called eccentric strengthening, or you do eccentric exercises where you grab a weight and your other hand would lift the weight up, and then you would slowly lower it. So you come here, lift the weight up, slowly lower it. Lift up, with a weight that you feel a burn in the muscle between reps like 8 and 12, do about 3 sets of 15, and then just stretching out that area. But the big thing is you want to avoid offending activities, so don't chunk it, thin it if anything, and just just be careful with your swing. Just avoid if you're like in a dangerous zone, where you're gonna a weird lie where you're gonna have to. We're just like take a drop, like don't hurt yourself. It's not worth it. So that's probably the best advice I could give for that.
Yeah.
Want anything to add?
No, yeah. And that's another thing, you have elbow pain, it might be because of your shoulder. It might be because of your neck. So don't think elbow pain means I have something wrong with my elbow. That's why it's great to get assessed by a PT, especially one that knows what we're talking about golf-wise.
I'm glad you brought that up, because elbow pain, I'm thinking golfer's elbow, but like if you don't want to guess, you want to test and assess, you don't want to guess. And I guess I just kind of guessed there. So but thankfully we have the golf doctor here to correct me when I make a mistake. So the next so I think we're ready for the demos? Okay. So now Paul is going to demonstrate, or make me demonstrate some stuff. So the first one is, can you demonstrate one simple exercise or stretch that all golfers should be doing to improve their swing?
Yeah, all right.
Get up for this
I like
one.
this, we're getting up.
Let's get a little movement here.
All right. Just out of the...
How much room you need?
All right, let me see. Do I want to go over the exercise first, or do I want to talk about that one injury one that we were talking about, like the reverse spine angle? Maybe talk about that a little bit.
Let's do reverse spine angle since it's fresh.
Yeah. So let's see. So can everyone see me if I swing a golf club right here? All right. So let's see. Is it easier to go this way? So let's say I swing a golf club, right, and I get here. My upper body is going to move onto this right hip. So I'm not moving my hip and my body with me, or my upper body with me. I'm just moving my upper body solely on this hip. Let's say I have a restriction here that I can't do that, but I still want to hit the ball really far. A lot of times what we'll do, instead of rotating around it, we'll actually bring this shoulder closer to the ground. That's what we call reverse angle, because we're essentially creating an angle in reverse. And now imagine if I want to hit this golf club, I have to now get out of that reverse and reverse in the opposite direction, which is where we get that. That's why it's so much load on your low back, because we go, instead of just going here and rotating down, I'm having to, I'm in a no-go zone. Now I got to come around to get through. So that's where we can see that low back being a lot more affected, because we're putting it in a position where now we have to go a complete 180 to get back. So that's what reverse spine angle is. And a lot of times people do that because they're trying to hit the ball really far. So that's one common injury we look for. So if you find yourself doing that, you're going to probably have some type of low back pain in the future if you don't address it. But let's talk about things we can do to kind of warm things up. So knowing that the hips and the shoulder and the core are a really big thing in this, we're going to look at an exercise that kind of incorporates all of them. So I'm going to show 2 different versions so people that maybe can't do a lunge can also do this. But we're going to start with the club overhead. So now I'm getting that mobility at my shoulder. Okay, we're going to do a lunge. And now you can either hold the lunge, I would say go all the way down to the ground, then you're going to rotate towards the hip and away from the hip. Big thing is trying to keep this hip from rotating. So I don't want this to collapse in when I come out or collapse that way. I want it to stay stable. And we'll just do maybe 10 per side that way. Now, let's say that was really easy, then you can just go and hold it. And now we're working on that single leg stability that we were talking about before. So that's a really good exercise you can do. And I recommend every good golfer that you ever watch warms up. So don't think you can go to the course, hit 10 balls, and then go play and not get injured. You're probably going to get injured. Hitting balls is the least we can do. So if anything, if you're not going to warm your body up, at least swing at 50% for 10, 15 balls and then warm up. So that'll be something good for us to go over too. So, all right, anything else we can do demonstration-wise? Let's see. You tell me.
Is there any other questions?
Let's see. Got the one simple exercise or stretch. That was a good one.
The quick test the golfer can do at home for mobility.
All right, nice. Yeah, this is a good one. So make sure you check out the YouTube too, Doctor of Golf. All this stuff is on there. Okay, so in case you guys are like, man, I forgot what Paul said, we already have 5 episodes up there that talk about the fundamentals of golf, and a lot of these are on there. So definitely check that out. But this one, a big thing with golf is getting in the correct posture. Okay, so if I set up and I'm like this and I try to swing, it's not going to be very good. How often do we see a golfer that's really good start like this? And vice versa, how many times do I see a golfer that's like really arched? It's hard to rotate around these positions. So I'd say the best one we can do is trying to get into a very neutral setup. So you're going to bring the club overhead. Now you want the butt of this club to kind of touch your pelvis, so right around your butt. This one is going to go right between your shoulder blades. I want to see if you can get down to your kind of setup as if you're going to hit like a driver or a 7-iron and keep these touching. A lot of times what you'll find out is this one starts to come up, which shows, okay, I'm not in the right posture for golf. So this is a simple one you can do at home because you get immediate feedback. If I'm not doing it correctly, it's going to come off of my hip. If I'm able to lunge forward or hinge at the hip, then great, I can get in that position, and that should be where you're working. You know, if you look at a golfer, they're pretty much in that neutral spine there. They're not tilted forward, and they're not excessively the other way. So an easy test you can do at home to kind of get into the correct position to start golf.
Doctor of Golf, thanks so much for doing this today. It was really great.
Yes.
We can't wait to do more of these.
Yeah, always,
So send us messages with any more questions you have. We'd be happy to do this in like a month or so.
Yeah,
again.
perfect.
Thanks again. Thanks for joining.